Yep.
Okay, here we go again. This time we're talking about understanding and managing responses to stress. When I realized that you could see me with my stupid headphones on, I decided I looked too stupid, so I took my headphones off as a response to stress. Okay, so here we go. This is chapter 10. We want to look at the consequences of stress. They're very difficult. Day-to-day stress is a killer. We're going to look at Cannon, Selye, and the psychoneuroimmunological models of stress. That big long word, psychoneuroimmunological, is my favorite word. We're going to look how responses to stress are mediated through all my favorite things: perception, personality, blah, blah. We'll go on. We're going to look at stress level, looking at the Recent Life Changes questionnaire, and then we're going to describe holistic approaches to stress management because they are the key, no question, the key to stress management. Let me tell you that my stress is elevated in some degree because I really don't know how to do this Zoom thing, but Andrew Boble, whom you might know as our tech guy, he comes and helps me out and makes me feel a whole lot better. So there it is. Okay. We're going to teach a classmate or patient a behavioral technique to help lower stress and anxiety, or you could teach yourself while you're at it. And then we're going to look at how cognition can help increase people's tolerance for stressful events. So we have just lots of things going on in this about 40 minutes that we have, and I'll try to keep it to that. Stress is the rate of wear and tear on your body, and it's pretty nonspecific. We can talk about stress. Since you can't tell me what you think about stress, if I asked you, I'll just be talking to myself, so I'm not going to do that. I want you to think about things that cause you stress and what it feels like when you're stressed out. I get really weird. I make people crazy, and I know that I'm doing it. But there it is. That's stress. Stressors can be psychological or physical, and they're incompatible with current functioning and require some level of adaptation because stressors are not helpful. Walter Cannon was someone who talked about the fight or flight response, saying that the body prepares to deal with a threat. Interestingly, new research indicates that men and women have different neural responses to stress, and you can look up the stress response information on page 196 of Varkarolus. That'll be helpful. Selye was the guy I studied as a student. The body attempts to keep a steady state called homeostasis. That's Selye in a nutshell. And then there's the general adaptation syndrome that has 3 stages: alarm, resistance, and exhaustion. As your body deals with what's going on, figures it out, and then just, if it's not managed, tires out. Lazarus, another important figure in looking at stress, talks about psychological reactions: distress, like dis anything, not good, negative events, and eustress, positive events. Eustress, for instance, stress on long bones. If you're not using those bones, they demineralize. So eustress is a positive event, especially for your bones. Serotonin synthesis is more active during periods of stress, and this may be mediated by the corticosteroids and ultimately mess with the way your brain responds, and you get depressed. Again, it's a nice example of the way your body and your brain work together. So serotonin is synthesized. That increased synthesis is mediated by corticosteroids, and ultimately it messes with your brain's ability to use serotonin effectively. So that's a problem. Oh, the immune stress response. Here we're looking at an interaction between the nervous system and the immune system during the alarm phase of the GAS. So that's a lot to say. Basically what it's saying is your brain and your body act together when you're feeling stressed. This psychoneuroimmunologic response involves everything along the core of your body. It's the hypothalamus, the pituitary, the adrenal cortex. So the argument essentially is that your brain stops where your legs begin, underneath the adrenal glands. And then it also involves the sympathetic adrenal medullary axis. So in a nutshell, hormones, brain function, adrenal function all act together in psychoneuroimmunology. And that acts to deal with stress as you approach it. And probably that's the most important thing to say about it. Things that cause you to feel stress, first of all, those things that are the stressors: fatigue, fear, loss, humiliation, unexpected happiness or success can be a stressor. Anything that changes the environment around you. Certainly your perception shapes the level of your response to stressors. Now, I want to digress for just a minute here to say that I study workplace bullying generally, but what we have found through our work is that people who are amenable to being bullied, people who are victimized by bullies, are people who have a long-lived sense of feeling inadequate. So their parents told them they were inadequate, their friends, whoever, their significant others, but they have believed for a long time, their perception has been that they are not adequate. And when a bully starts in on them, they buy the whole argument. It's a problem. Affecting that perception and that response to stressors, our personality itself, childhood experiences, past experiences, as I just said, and social support in the present time. So past experience can set you up one way, social support can help you to buffer that experience you had as a younger person. You can heal, you can be better. But for some people, stress is just a way of life, and I'm sure you know those people and see them all around you. To help you deal with stress, there are self-help groups. Sometimes these self-help groups are useful, sometimes they are not, so that the support they provide may be low or high quality. The very culture you work in can help you to mediate stress. In a workplace environment, if people are bullying and it's allowed to go on, and no one addresses it, and it has to be addressed at the very highest level. It's not like you can say to your bully perpetrator, stop doing this to me, because obviously they're not going to stop. But the culture that you live in can make a big difference in terms of the way you are feeling and experiencing your life, whether or not you feel stressed. And certainly spirituality and religious beliefs can help you at a very core level to deal with stress. There are a number of ways to measure stress responses. One is the social readjustment rating scale. This measures the level of positive and negative stressful life events over a 1-year period. And then, of course, there is assessing coping styles. And we just talked a few minutes ago about coping mechanisms, about defense mechanisms, some of which are helpful, some of which are not helpful. If you're not dealing with your stress, you're going to get anxious. You may need to be medicated. The patients you're working with certainly may need to be medicated. The choice of medication can be really important. And number one bad drug, in my view, as I mentioned, benzodiazepines. So generally speaking, they're just not good. And yet people, of course, they like to have them because you feel real good on them, especially if they're inhibiting GABA. All right, stress management techniques. There are a number of them, and relaxation, meditation, guided imagery, and breathing. And we're going to try to look at a few of those. First of all, physical exercise really helps to reduce stress, if for no other reason, because it gets endorphins going. And they just make you feel better. So people really get quite addicted to exercise. Look at all those runners. They just are having a great time running, wouldn't give it up. It's endorphins that seem to help them move forward. There is progressive muscle relaxation. Unfortunately, we will not get to practice this in class. I'm sure that Dr. Kasurka will provide some opportunities for this because it's a very useful thing to do. We use it in maternity for a long, long time. I was a Lamaze certified educator. Lamaze's argument was that you teach yourself to relax by working from head to toe, and you just deal with the contractions that are coming along. Now, you've already been through maternity, so you know what this is happening. I used to tell my clients, you can't quite see this, to think of yourself as a giant uterus. Everything there, your whole body is involved in getting this uterus to contract and getting your cervix to go from this big to this big, and then to go from as thick as almost your finger to this thin, that's a lot of work to do. So I'll stand. There's a cervix. See, it's a nice thick cervix. It's got to thin out and it's got to open up. And so by progressively relaxing your muscles, you allow your uterus to do the job it came here to do. It makes this whole process of pushing out a baby a whole lot easier. So progressive muscle relaxation, also helpful to get you to sleep at night. Biofeedback is a process by which your heart rate and respiratory rate and blood pressure are monitored, and you learn to control those responses to stress. It is a very helpful thing to do. I'm not very good at it, but there are people who really can slow their hearts down and be very effective at it. In fact, now, you know, how much of this is urban myth? Years ago, I had a patient who, her name was Flossie. She had been hospitalized for the better part of her life. She was probably mid-late 60s, maybe into her 70s. She's been in the hospital for 40-some years. See, we don't do that anymore. Because of the whole notion of least restrictive environment. The thinking was that state mental institutions were restrictive. I'm not sure, frankly, personally, they're any more restrictive than bridges, but that's where people are now, under bridges. We have not done a very good job, in my view, of providing community-based treatment. In any case, Flossie, boy, she was something. She was a piece of work. And I heard from several people more than once that through biofeedback, Flossie was able to slow her heart down to such a rate that they thought she was dead. Now again, is that really true, or was it an urban myth? I mean, she was an interesting woman in any case, but biofeedback is your ability to manage your physical responses to stress. Now again, cognitive approaches to stress management are very popular right now, and there are a number of things that can be done to manage your stress. First of all is cognitive reframing, so that you learn to think differently about things and modify your behavior as a result. Secondly, mindfulness. Now, mindfulness really does keep you in the moment, but all it says is, what am I doing right now that isn't helping me to manage? An interesting thing for people with eating disorders. If you're not mindful, it's like, oh, I gotta eat, gotta eat, gotta eat, gotta eat. So you're putting all this stuff in your mouth, when instead you say to yourself, wait a minute, am I really hungry? Am I just eating because it's there? Am I eating because I'm afraid if I don't eat, I'll starve to death? Which seems like a cognitive thing, but it's really a much more emotional problem that's sort of driving underneath what you're doing. Just thinking about it. What am I eating? What might I eat? If people were more mindful about this, they might not feel obliged to eat so much. Also, mindfulness can be used with medication, with alcohol, with stress generally. Can I stay in the moment? Can I just be with myself for a minute? And then can I calm down? It's a good practice. Journaling, very helpful. Journaling is highly recommended and frequently used by people. For me personally, I think I'm running a little faster than that. Maybe not, could be fooling myself. Journaling is, I love to write. I love to write, but not just to make notes to myself. I want my journaling to mean something at the end of the day. So I found it a helpful approach for me in managing stress through journaling is to take note of quotes from books that I'm reading that really speak to me. No remarkable quote comes to mind right now, but I quote them, I say where they came from, and then I have them, and sometimes I use them, I work them into something that I'm writing, because as I said, I study workplace bullying, I write about it. So here's one that just happened in a Stephen King book that's called 11/22/63. Now, probably none of you was around on 11/22/63, but that is the day that President Kennedy was shot. I was in the 6th grade. And I remember the teacher from down the hall coming into my teacher, Mrs. Thomas, and saying, oh my God, Anita, the president's been shot. So in this book, 11/22/63, King writes about, as he always does, such interesting things, somebody who was able to travel back and forth through time and went back to 11/22/63 to see if he could prevent President Kennedy from being shot. It's a great book. Within the text, there's a woman who's involved with some people, and they're bullying her. And she doesn't quite get it yet. So the quote reads something like this: "She smiled in the way people do when they know the joke is on them, but not why." And that's often how, when you're being bullied, as a victim of bullying, that's it. You know the joke is on you, but not why. People who are being bullied are quite anxious and they don't figure out what's going on. They blame themselves. They don't see that the bully, him or herself, has their own issues to deal with. So they smile in the way people do when they know the joke is on them, but not why. So those are the sorts of things I put in my journal, specific quotes that I find very useful for just thinking about things. And then I work them into papers that I've written. So if you ever want to read my most recent paper that has that quote in it, ask me, I'll show you. Humor, yes indeed. There is nothing like a good laugh to reduce stress. So think about a situation differently, make a joke. You've seen it 100 times. If anybody's a fan of Mary Poppins, you remember, I hope you remember, I love Mary Poppins. Watch it again if you haven't. It's really an important movie. Mr. Banks has lost everything. And he goes to the bank to deal with the situation. And then, making a joke about grammar, he says, a wooden leg named Smith. And one of the old guys listens to him talking about a wooden leg named Smith. And pretty soon he gets hysterical because he realizes the grammatical error there. The leg wasn't obviously named Smith. And he laughs in the way that, if my kids were here, they'd appreciate it more. But he kind of goes, and then he dies laughing. So that's how I want to go. I want to die laughing. The trouble is, you have to use humor carefully because you might be making a joke about something somebody else doesn't think is funny, and that goes over like a lead balloon. Joking is a very good thing. We use one-liners all the time at my house just to deal with stuff. So one-liners from movies most of the time. One of our favorites, again, forgive me, I'll tell this little story. There's a great old movie called Dave about a guy who looks exactly like the president. The president is kind of a schmuck, and this guy, Dave, looks just like the president. So they plug him in to take over because the schmucky president has had a stroke. And he's got to speak to his wife, really the president's wife, but there she is. So she agrees. They're not getting along, the president and his wife. She agrees to go with him to do something, and he says to her, "Thank you for doing this, Ellen." So many times if something comes up, somebody does something nice for us, we say, "Thank you for doing this, Ellen." Ha ha ha. It's hysterically funny, isn't it? It works for us. Watch a movie. There's also nothing like a good movie to reduce stress. And just to remind you, sometimes even what's important. All right, stress busters, get enough sleep. Ha ha ha. I know that's not always easy. Some of it is our own darn fault. Get sleep, give yourself a day off once in a while. Get 30 minutes of exercise at least 3 times a week. It just keeps you moving. Reduce the amount of caffeine that you're taking. That can, and caffeine is so insidious. On the one hand, it's like, hey, this is cool, I'm good. And then it really kind of sneaks up on you, and pretty soon you're bouncing off the walls. Caffeine is terribly addictive. In fact, in psychotic people, there is a link between dopamine function, maybe it's true in non-psychotic people too, and caffeine ingestion, not injection. Boy, you have severely psychotic people, they're just going from cigarette butt to cigarette butt to cigarette butt. It's a problem because of, that's not so much caffeine. Then they're doing the caffeine, but also with nicotine. All of these stimulants, they need the stimulants because their dopamine systems are just wreaking havoc with them. So caffeine is a problem. Nicotine is a problem. Get rid of it. And sorry to jump to nicotine there for a minute. Music, love it. When I work, I put music on. Can't have words because then I get tied up in the words, but just listening to the music, it grounds me and I'm able to work. Pets, we know this. Pet therapy, very popular way for people to deal with stress. Sometimes we had a program where I used to teach in Ohio. Pets came into the dorms at finals and midterm time to work with the students to help them feel less stressed. Massage, of course, which sort of links your mind and your body. If you're going to have a massage, you got to have a good massage therapist, or it's like no point. Why bother? So, and there are probably other things you do to relax. But again, you want to use effective stress busters, not ineffective stress busters. Not overeating, not using drugs. Not doing the crazy stuff that the defense mechanisms we talked about can yield, like projecting your stress, as we talked about, or sublimating your stress. Remember, we talked about all those things. You don't want to go there. You want to be in touch with yourself and know where you're headed. So there's that. Healthy. Well, my husband's a food scientist. Okay, healthy foods. But what constitutes healthy? These things all look just fine. Let me tell you, in this corn, there is a whole lot of starch at the end of the day. The other fruits and vegetables here, not so much. But ultimately, starch breaks down into sugar. You're getting a lot of sugars in these fruits anyhow. Everything in moderation is probably the way to go. It's not like you have to become a vegan or anything, lest that floats your boat, and I suppose you can become a vegan. But yeah, you do need to watch what's in your diet, and if things are bothering you, don't do it. But I would say overall, moderation. People are crazy these days about local and farm grown, and they don't want GMOs, and they don't want cows treated with whatever that hormone is that they treat. I don't know. My food scientist husband knows. People are crazy. The whole notion of organic, don't even get me started. Organic is kind of a joke, and people are using it to market. It doesn't mean anything. So healthy foods, don't get sucked into somebody's argument about what's healthy versus what is not. Everything in moderation is fine. Okay. Sleep, as we mentioned. Exercise, look at these. Pets, these are just examples of all the things we talked about. Social groups, social support. So that's all very important. I think we are done with the slides, and unfortunately, because I am not really adept at this, it's not like I could pull something else in here to add to your learning pleasure. So with this, I'm going to stop, and I'm basically talking to myself here to know that we'll get this uploaded so you have access to it, and soon we'll be there for you. So should you have any questions, please let me know. If I think of something that I haven't mentioned here that I learned I should have emphasized, I'll send you some notes about it. I think we'll be in good shape. So for now, thanks. It's been real. I love teaching psych. Hope you had a good time. It's kind of weird talking to myself here, but I guess that's okay. All right, thanks. See you soon. Do good. Bye.